my colleagues for allowing us to extend question period. My questions today are for the Minister of Health, and they're regarding paramedic services. Mr. Speaker, a few years ago, I was happy to praise the department's ingenuity when they had utilized paramedics to prevent health center closures. Mr. Speaker, last year when the paramedics contract exceeded $25 million, I recommended that the minister integrate paramedics into the public service. So I'd like to ask if the minister would be able to provide an update on the status of this effort. Thank you, Mr. Speaker.
Honourable Minister of Health, Mr. Ming.
Thank you, Mr. Speaker, and I thank my colleague for the question.
Highlighted a key initiative of the Department of Health over the past years since the program was established. Paramedics have helped us to provide so much valuable service. They've helped us to keep our health centers, health facilities open where staff shortages might have resulted in closures. Paramedics have really helped us out. In terms of the incorporation of paramedics into the department, that's an ongoing process. We had paramedics in the last fiscal year. They were deployed to all of our 24 community health centers, plus Kakatani General Hospital, so every facility that we have right across Nunavut. Our spending on paramedic services has decreased from last fiscal year, and this highlights progress that we've made on our recruitment and retention strategy towards nursing.
First supplementary, Mr. Lightstone.
Thank you, Mr. Speaker. I appreciate the minister's response that this initiative is ongoing. As was previously indicated just today, one factor that enables the enhancement of healthcare service delivery in Nunavut is hiring local and hiring bilingual healthcare professionals. So my next question I'd like to ask the minister is, with the current paramedic service contract, whether or not there are any stipulations that require the training of local bilingual paramedics. Thank you, Mr. Speaker.
Minister of Health, Mr. Min.
The current contracts do not include requirements around training. However, we would welcome any investments towards that end. Mr. Speaker, we have primary care paramedics working in territory, as well as advanced care paramedics. And we've also secured a paramedic practice consultant who started working in April 2024. And that position is to centralize work on the paramedic program, support the operation, as well as continuous quality improvement, and supporting a trained and competent paramedic workforce.
Second and final supplementary, Mr. Lightstone.
Thank you, Mr. Speaker. Mr. Speaker, another instance where I applauded the Department of Health was when they had partnered with NTI and Ottawa University to secure seats in the Doctor of Medicine program. Mr. Speaker, I think that the Department of Health can and should be helping and assisting Nunavut with achieving their paramedic program courses and qualifications. As the minister has indicated, there is an obvious need for paramedics within the public service, but there's also a need for the paramedics services in municipalities. Mr. Speaker, the minister had previously indicated or named the Ambulances for Nunavut Nonprofit Society, which has sent up a total of, I believe, 15 ambulances to our territories, to our communities. Unfortunately, a majority of these are just used as stretcher services, which is glorified taxi, bringing medical care patients from health centers to the air terminals. So I would like to ask if the minister would direct his staff to bring up discussions with NTI and Southern post-secondary institutions to help secure seats, to have a number of Nunavut go down and train together as a cohort. Thank you, Mr. Speaker.
Minister of Health, Mr. May.
That's an excellent suggestion. However, we're playing this. We're in a bit of a dance right now, where we're being asked to commit to things, and then we're also being told not to tie the hands of the next government. So, I'll dance back and forth and try to find the right moves there, Mr. Speaker. But the paramedic programs, typically they're a 1 to 2 year diploma program, and that training getting more Inuit into health occupations is a long-standing item at the tripartite table between Nunavut, Tungavik, ourselves, and Indigenous Services Canada. So I can highlight the paramedic issue or opportunity for discussion at that table.